Good evening, everyone. This is our bi-weekly COVID-19 stats report. My name is Sara, epidemiologist at the Jefferson County Health Department. We appreciate you tuning in with us tonight. We are covering the CDC Week 11, which includes reports from Sunday, March 14th to Saturday, March 20th. Our overall weekly case count slightly increased this past week. We had a total of 194 confirmed and probable COVID-19 cases, which is a 22% increase from the week prior. The first thing you might notice on our color chart is that the weekly case count has increased enough to put us back in orange status. That 7-day rolling average of cases per day per 100,000 residents was 12.32 for week 11. Now, we're not alone. Cases across the U.S. have increased around 2% over the course of the last 7 days as well. Our percent positivity, which is 5.85%, has increased enough that it is now classified as yellow instead of the previously reported light green as well. For the past 2 weeks, Jefferson County has seen a small increase in cases, unfortunately. I know a lot of us are experiencing a sort of pandemic fatigue and are really wanting things to go back to normal. It's really easy to get sidetracked when we see a lot of these places opening back up and certain restrictions being lifted, but we really need to remember that we can't let our guard down just quite yet. We're starting to see the variants become more widespread, and to give you an example, it's suspected that the B.1.1.7 variant represents about 40% of the cases in the US, and it's likely going to become the dominant variant over the course of the next couple of weeks. When you look at the CDC website, Missouri is only reporting 5 cases of B.1.1.7, but there are likely many more cases circulating undetected because of a lack of what we call genomic sequencing. This is how we identify a variant in a particular sample. So the genomic surveillance is just really limited right now, and that's why there are not more confirmed cases of these variants. And to explain a little bit more why that B.1.1.7 variant is causing us some worry, the CDC has actually reported some pretty alarming data trends in the areas where there are a high number of confirmed cases of B.1.1.7. In these areas, cases and hospitalizations have either been on the rise or they've been plateauing. Right now, it's that crucial time that's really important to maintain our current restrictions instead of relaxing them as other states have done. Keeping the mask mandate in place for a little bit longer and promoting any other prevention measures is hopefully going to prevent any surge while we're racing to vaccinate the community. We really need the cooperation of everyone in the community right now in order to prevent these variants from spreading further. Speaking of the vaccine data, we have about 13.84% of Jefferson County residents who have completed their first dose of the vaccine. 7.28% of the community has completed both doses and are considered fully vaccinated. Those who received the Johnson & Johnson vaccine, which is that single-dose vaccine, are included in the 7.28% of individuals who are fully vaccinated. We have almost 44% of our 65 and older population who've completed their first dose, and about 20% of the 65 and older population has been fully vaccinated, so they've completed both doses. Continuing to focus on vaccinating this higher risk group will also certainly help prevent those hospitalizations and the COVID-related deaths, which is why that 65 and older population was included in the phase 1B of vaccine distribution. If you're interested in receiving a vaccination from us here at the health department, make sure you fill out that vaccine interest survey on the homepage of our website. Brianne and Gina also recently published a video explaining vaccine information much more in detail, and that can be found on our social media pages as well. That just about wraps up our Epi report this evening. Thanks for listening in, and as always, you can find more detailed statistics on our COVID-19 dashboard on the website, jeffcohealth.org. Please stay safe and stay healthy, and have a great evening.